started. Okay, so welcome everybody to this week's call. It is Dr. Joseph Ahrens' call, and my name's Jackie Boyle, and I'd like to apologise on behalf of Dr. Ahrens that he will not be here today, but I'm going to run through a presentation on EMULIN and 24/7 and looking at the basics of this product, giving you a really good understanding on how to explain it to people. Like what is it about these products? How do you give you a better understanding that we potentially how we have had to explain a product has changed. So we'll get going and get moving through that because I really do want to let you have a bit of a look through, and then you obviously can give me some information at the tail end of it once we finish as to what your thoughts have been on this. So, as I said, I want to say as we go through, when we talk about EMULIN, it is 24/7 as well. That, when Dr. Ahrens did create this, he did create what we feel is a missing link that potentially can assist us in our health and our well-being. And, the man himself has got the credibility behind him, being a dual-nominated Nobel Prize scientist, having a doctorate, being a former director in the Florida Citrus Board, and also the founder of his company, ATM Metabolics, and the inventor of EMULIN and also 24/7 AM/PM. He comes with a lot of credibility, and as you know, when I introduce him each week, he's quite humble and gets a little bit embarrassed about it, but the knowledge behind him is just incredible. Each time that we hear him talk, it just becomes evident to me over 6 years of knowing this man that I constantly keep on learning and keep on adding knowledge into my books of my library of knowledge. As I said, he is a dual-nominated Nobel Prize scientist. He was nominated in 2015 and 16. 2015 was for the work with EMULIN, the discovery. 2016 was he developed a cure for Ebola and SARS, which we're all aware of what that would be. So, there's a lot of credibility there for him with his knowledge base. There's a lot of research behind, but I want to touch base on a very important area just to begin with. When we do talk about any product, but specifically I'm talking about EMULIN and 24/7 today, that we talk about that we're assisting and supporting to manage symptoms. We're not talking about actual conditions, or if we do refer to a condition, we're talking about how we've noticed the symptoms of that condition has been able to be managed and supported and assisted with the use of these products, which is a personal thought pattern from yourself. Just a compliance notice, I put this in here today because on Dr. Ahrens' page, when we get comments through there, I just want people to know that any reference to COVID-19, coronavirus, and or the pandemic in claims to health with respect will be removed. So I hope everybody does understand that too, because it puts any product under the radar, and then the company potentially gets a fine and we can lose that product. So it's important to understand that as well. So when we start and we look at, what actually is EMULIN, and why is it essential for everyone? What is the synergy of these three flavonoids? Like, they are flavonoids that are in EMULIN. So I want people to understand when we talk about EMULIN, they're actually flavonoids. And what is the link between today's nutrition and EMULIN when we talk about it? Okay, so let me ask you these things first. I'd like you to think about exactly how you feel right now. Each and every one of you, for those that are here on this call and for those that listen to it afterwards, think about how you actually feel honestly right now. And let's consider what a difference your lifestyle choices can make to your health, because they really do make a difference when you make a few changes. And if we talk about health, wealth, and happiness, health is, do you want to feel better? I personally know I do, because I want to be able to wake up each morning, actually feel more energized and enjoy my family, my friends, and to be able to socialize. I want to be able to have the wealth of, I want to be rich in my health. So, being ill costs a lot of money. So invest time in your health. Before your health, invest all of your time. And happiness, would you like to have less aches and pains? And could you imagine what that would feel like, and that what you would be able to do and how you would be able to tick off your bucket list of things that you want to be able to do by having better health. So health, wealth, and happiness are three important words in anybody's life. But EMULIN needs time to assist and support your body. So I want you to really think about this when you look at it, that what do I mean by this? Well, you know, if I start and look at, I'm going to put a little laser on here so I can show you. I made this post up because when I first started taking these products, EMULIN, I looked at a 12-month diary, and this is exactly how I felt at the time. I was pretty miserable. You know, and 3 months in, I noticed a huge difference in things for myself. So I was still a bit blue. By 6 months, I was starting to smile again. By 9 months, I felt pretty darn special. And by 12 months, that full circle of a year, my whole body had the support and it started to heal itself. It was just incredible how much of a difference that 12 months made. But I looked at every blood cycle and every 3 months at a cellular level, and it made a huge difference. So if we talk about, when you bring somebody and you introduce these products to people, people feel the difference within weeks, and they can feel fantastic. And you will be amazed in 30 days. But just note that everybody has varied response times depending on their bodies. Now, you know, I've had this discussion with Dr. Ahrens, and I said to him, because he asked me a very clear question, why did I continue with it at the time? I said, because I had no other choice, but I believed that it had something there that was going to make a difference for me. And I can tell you that my response did change. It altered every couple of weeks. I noticed a difference in the first week. I noticed a difference in the second week. But everybody is going to have a different response. There's no guarantee that everything is going to be the same. But there are a few things that seem to be consistent, that when people start taking it, that the mental clarity that becomes quite clear for people, because EMULIN has the ability to be able to cross the blood-brain barrier for people, which is quite phenomenal, which is where we start looking at having the ability to control sugars throughout the body. Being able to cross the blood-brain barrier can assist you in mental clarity and seeing life with a clear focus, minus any brain fog. So you're able to see, you know, what's happening in your future. And one of the first steps forward when we start looking at it is addressing and understanding what are carbohydrates and sugars. Like, they get thrown around quite loosely, and sometimes, you know, I've had a big education on this over the years in my fields of really understanding field of my education on what carbohydrates are and what sugars are, which might sound like quite a silly thing, but when you delve into it, of understanding what's actually in products and why are they so potentially detrimental to our health. Now, I want to say before I go any further with this, rice, when we start looking at, and you can do your own research on this, that rice is one of the highest levels of sugar in many foods that we have out there. But we start looking at diabetes throughout the world, and a lot of the Asian countries are at the highest rate of diabetes. And the reason being is because rice is such an economical food. It feeds many mouths, and it's, you know, it has the ability to not have to put a whole lot of other food there. So cost-wise, being able to get a lot there to feed a lot of people makes a huge difference. And so when you start looking at that, the problem with rice being is that carbohydrate, it's a carbohydrate, and it metabolizes into simple sugars that raise the blood sugar levels. And if we look at a small bowl of rice that you normally see if you go into a restaurant, this is what we're looking in the content of sugar. It's quite a lot. So our body has a lot to contend with to try and process that. In nature, sugar is either a poison and or an energy source. So if you're not using it, you know, you'll eat sugar, so you'll crave it. So if we start looking at number one here, and you'll crave it, you like it, it becomes addictive. It's going to then take you to where you're going to get a blood sugar spike. So the dopamine in the brain is spiked, and you feel really good. It's like when you eat chocolate. I don't know what it is, but you eat chocolate and it's like, I feel really great. But it's like an empty calorie. There's no content in it to sustain energy. So the blood sugar level continues to drop rapidly. High insulin levels will then cause a fat storage, and the body craves the loss of the sugar high. So we come back around to where we start to get hungry and we start to crave again. So it becomes like this vicious, deadly cycle with sugar. So when we eat sugar, the part of the brain which lights up is the same part which lights up when people use cocaine. I'm not saying that, any claims here to say that and or, but it gives you a really big indication on how much of an impact that sugar can have to the body. Refined sugar, it's a toxin, it's an addictive drug, it's actually a poison to the body. It was never meant to be stored in our bodies, it's meant to be used as energy. But as we've grown over the years, we've become a lot more sedentary in general. So if we look at the consumption of sugar from the 1700s to 2000, and you could imagine here we are 21 years later, nearly 22 years later, I would think that 110 pounds per year potentially could be 150 pounds, probably even more per year because of what our food choices are and what we have available. So carbohydrates are individual units of sugar. Not all of them are bad, but they are individual units of sugar. And we need to reduce our intake of carbohydrates and increase proteins and fats. And if you think about it, it is possible to have a meal a day or a day a week without carbohydrates. Just go carbohydrate free and allow your body a little bit of a rest, which is then going to reduce the amount of sugar that you're going to be taking in. As I mentioned before, like rice has no nutritional benefit except when used as an energy source. So if you're not using it to fuel your body, just like fuel in the car, if it's not being used, it's going to then end up turning into fat within the body, which then potentially has a domino effect into other symptoms within the body. So real food, and as we know with the enzymes that we're all aware of, currently now with what's happened with the additional product that we have under our menu of products, real food has color and taste and can be eaten raw. We cannot eat wheat and rice raw because our bodies do not have the enzymes to digest them. So rice has no benefit to the body unless you're actually using it as fuel. So how to tell if something is a good carbohydrate is to ask if you can eat it raw. And this comes back to the raw food as to what we're all seeing at the moment and being educated in. So excess carbs lead to carb toxicity, which is an increased blood sugar, elevated blood fats, excessive weight gain, poor sleep, sluggish physical and mental energy, tiredness, constant hunger, and prolonged excess carbs can be the root cause of most diseases and symptoms that people experience. We do need to eat fruit, eggs, and nuts. We cannot live without protein and fats, but we can live without carbohydrates. If you think about the caveman diet and cavemen going back thousands and thousands of years ago, as opposed to now 1 in 5 people are carbohydrate sensitive. So just note, this picture for me tells a big story. Refined carbohydrates and sugars fuel inflammation. So what is inflammation? I did mention to you about it crossing the blood-brain barrier, EMULIN, having that ability to be able to do that. Inflammation is the first step of the immune response to infection, irritation, or injury. Short-term or acute inflammation is useful for the body. So if you cut yourself, if you break your bone, you want inflammation to go to that site to be able to help the body to repair. But it's when we get long-term chronic inflammation that can cause other diseases. And some of them can be life-threatening, such as heart disease, diabetes, cancer, and many more. So excessive consumption of refined carbohydrates can lead to inflammation. So it's important to understand what you're fueling your body with. So in short, 85 to 95% of health disorders are inflammation-based, meaning they were likely triggered by an inflammation or an inflammatory imbalance. So why does this product differ to all other anti-inflammation products on the market? It is simple because it deals with the root cause, or it can assist the body with the root cause and not just the symptoms thereof. But primarily, as I said, we're not making any claims here because we are targeting symptoms. There are currently no other products on the market of this nature like this, because you need to understand the research behind it, as I'll explain as we go forward. So EMULIN regulates the immune system to support the inflammatory levels within the body. I want you to have a little look at this, not a happy little man at all. So whether I've got a little man here, so whether it be a male, female, or whoever it may be, and this can be of any age, sadly, in this day and age. You know, can you relate to any of these? Maybe somebody you know. Because when you look around that man, there are a lot of conditions that it's pointing to, and they all have one thing in common. They have the symptoms of inflammation. So if we can address those areas and support those symptoms, we're going to help to make that person a lot happier. So inflammation is present in all of these conditions that you'll see in the next slide that I'm going to show you. And you will notice that the roots of the tree are relying on our nutritional choices to stay healthy. So what you choose to actually fuel your body with. Deficiencies within can develop inflammatory related conditions. So when we look at the roots of the tree, underneath it, have a look at underneath, because do you really know what's going on inside of your body, your internal organs? Do any of us really know? The only way that we can know is to go and have the doctors to be able to run tests. And even then, sometimes we still do not know. But what we can see on the outside, which is where the tree is flourishing, we can recognize, well, this is what's happening on the outside, because by the time that the roots of the tree are starting to feel something and there's things that are going on internally, we then find out that we are dealing with some sort of a condition. So we want to try and support the body to heal itself from those areas of disease. And I don't say disease, dis-ease, hyphenated. So EMULIN puts back what has been taken out of our original diets. Have a little think about that with what the synergy of this product is. And natural changes do occur. So food simply lacked nutrients needed from what we used to get from our food when it was grown. Now, whether that be from environmental issues with the soil that it was grown in, to now having a longevity of needing the products to stay, have a longer shelf life, whether it be a raw food or whether it be a processed food. They're doing things to make sure we have a longer shelf life. And this is where flavonoid deficiency syndrome occurred, because we have a lack of flavonoids in our diets, which can result in a dysfunctional carbohydrate metabolism and chronic inflammation and disease. Flavonoids are found in fruit and vegetables. They replace what is missing from our diet. Flavonoid deficiency syndrome results in low energy, and eating more carbohydrates only makes it worse. But I want you to stop, because it is really important that you do understand that we are not curing, fixing, and or treating any diseases, rather helping the body in healing itself. So we feel as though the missing link to nutrition with these flavonoids is called EMULIN. And who, what, and how? What is the missing link of nutrition? Well, making up of EMULIN, we start looking at what's actually in these three flavonoids that are the main core extracts. They're extracts of compounds. And I have it asked often, and I know Dr. Ahrens has questions asked, but I'm allergic to coffee. I'm allergic to some of these ingredients that are in here. How can I take these? Because they are extracts of the compounds. But each one of these, the chlorogenic acid, which comes from coffee beans, has the potential of being able to help you in all of these areas that you are seeing right here. Going into myricidin, which comes from grapes. And we've heard Dr. Ahrens talk about the importance of the color in our food and why we need to have such colors in our food. It's because of the flavonoids, because they have the ability to be able to support the body and assist it in all of these areas as well. Then we look at quercetin, and quercetin is comes from the onion bulb. And again, if we talk about what is potentially somebody can't eat an onion, or you can't give an onion to your pets, or you can't give a grape to your pets because, you know, it doesn't, if you gave them a real onion or a raw grape, your dog isn't going to like it. But yet I give my dogs EMULIN and have done for 6 years because it's an extract of a compound. because I want them to be healthy and have their body supported in being able to manage what's happening in the symptoms of their body. So when we look at those three flavonoids, it's a synergy of these three active ingredients. And we are what we eat. And as you know, it's an essential vitamin called EMULIN, which is a flavonoid, or combined together. How does EMULIN work? Think about having 7 traffic cops. So if you've got 7 police officers and they're managing sugar at 7 critical points along the road from the time that you actually eat your food until you disperse it through when you go to the toilet. It regulates, it upregulates, or it downregulates 7 key enzymes in your body to control how you use sugar. There are 7 points in the body which interact with carbohydrates, and we need to modify the effect of carbohydrates in the body, because the body wants to maintain what we call status quo, which is homeostasis. So it's like trying to control traffic in a big city with 1 cop. You just can't do it. So this is why there's those 7 key elements in there. And just for those that are listening, if you didn't already know, EMULIN is the world's first carbohydrate manager, refined carbohydrate manager, and sugar controller. So this is where these 7 key elements are very important to understand. So how can EMULIN assist and support the body? EMULIN can assist with better energy and sleep. It can lessen joint pain, reduce cravings for sweet and carbohydrate foods. EMULIN provides a daily dose of flavonols to reset the metabolism. So within a week, you will see an improvement in your health, and everyone is different, so the body will respond differently too. Now, what will you see? What will you notice? I honestly do not know, because everybody is so different, but I do guarantee you, you're going to notice a difference. You've just got to give it time to be able to do its job. Let's see if I can, just hang on a second, Sarah. I just need to mute Dan. There we go. So when we talk about balancing the body, we're looking at managing sugars, supporting the immune system, and restore to normal recovery. So it regulates inflammation and properly manages sugar in your diet as nature intended it to be. If we head on to the next section, who should take EMULIN? Just like a vitamin, everybody. So whether it be from when you're pregnant and you've got a young like a fetus growing inside of your body, if you're a female, through to an old age till you take your last breath. Anybody can literally take it. There are a couple of areas where you need to make sure that you, if you've got blood sugar issues, like if you're on warfarin, that is something that has shown that you need to make sure that you converse with your doctor and monitor that. But as I said, everybody can take it, even through to your furry friends. My dogs, as I said, have been taking it for 6 years. So I do hear you ask, we have 2 of them, so which one do you need? And firstly, let me tell you that everybody does need it. It is imperative. For the 6 years that I've been taking it, my body has simply done a complete turnaround. We have made 2 formulas of EMULIN, and they both manage refined carbohydrates and sugar metabolism, and they both manage inflammation symptoms. So we've got one, EMULIN M, which is for mental clarity. It's an inflammation manager and also an immune support. It has recently had the banned substance control seal, which I'll go into that a little bit further. Then we have EMULIN C, and it is predominantly for people that are wanting to maintain proper sugar levels and also to accelerate potentially weight loss efforts. Potentially, when we look at EMULIN C, though, it's really about people that have sugar instability. So and it's because of the quercetin. The quercetin in EMULIN, there is a big difference in ratio between EMULIN M and EMULIN C. So if you have somebody that has sugar instabilities, like that is type 1, type 2, even with Alzheimer's, dementia, Parkinson's, you would be wanting them to have, or gestational diabetes, you would be wanting them to have EMULIN C because of the quercetin levels in there. They're a lot lower. So we're not trying to shift sugars rapidly through the body. We're trying to maintain an easy management system, because otherwise it can create a lot of chaos for somebody if they're on insulin. So gradually it will assist the body. So if we start looking at what are refined carbohydrates are, when we start looking at this area here, are simply a highly processed and their nutrients like vitamins and minerals and fiber has been removed. So if we look at the blood sugar levels when we have these, as I said, with white rice, you can see how rapidly with white rice that you're going to get your blood sugar levels will rise. As opposed to spinach, which is sitting at the green, it's not going to raise as much because there's hardly any refined carbohydrates in there. Now, constant intake of excess carbohydrates leads to chronic inflammation. And this is where we start looking at the 3 active ingredients along here. And this is what they look like from a scientific point of view. And EMULIN simply putting back into the body what has been taken out of your original diet. Families of all ages are safe to use this plant-based vitamin called EMULIN, as we've said before. And everyone is different. So I want to make sure I put this through to people that you understand that no 2 people are the same. The recommended dose, now this is really important for people to understand, that it may need adjusting. Now it's 2 capsules for a 170-pound individual. So now that's just for a healthy person. So if you've got some things that you're trying to manage or you're trying to deal with, you may need more. And if you find that you're having some issues in regards to that you want to, you may be struggling with a cold, or you might be having some things that are happening low in energy, or you may be suffering with the symptoms of something, you may actually want to what we call saturate. So when we talk about saturation, if I'm taking 6 a day, that's my regular intake. So I'll talk about for myself. If I find that I need more, I will double it and take 10 to 12 a day, and I'll do it for 3 to 4 days just to give my body that extra support that it needs, and then I will take it back to 6 a day as what it was previously, because that's my daily intake my system needs. I've worked that out. But not everybody needs that. So that's what I'm saying. Everybody is different. So if you're navigating with a medical condition that is challenging you, please consider adjusting your normal daily doses. It can assist and support you in reducing inflammation and symptoms. So even if you find that you're a little bit dull, like you're a bit tired, you're running a little bit low on energy, put a few extra EMULIN into your system for 2 or 3 days, give your body a little bit extra support, and then go back to your normal dose again. Don't be frightened to increase or decrease, because it's food that you're actually giving your body. Detoxing can be experienced. So when you start people off initially, just let them know that they may find that they may detox, because remember, when you look at EMULIN, it is the world's first carbohydrate manager. So it chaperones 1/3 of your refined carbohydrates through your body. So rather than it actually, you eat your food and then all your carbohydrates, if you're not going to burn them up as energy, it just gets dumped into the body and then it is transformed into sugar. Whereas EMULIN actually chaperones up to 1/3 of your refined carbohydrates. And it also helps control your sugars. So you can imagine if somebody all of a sudden is having 1/3 of their refined carbohydrates chaperoned and they're having their sugars managed or controlled a little bit differently, the body's potentially going to say, hey, hang on a minute, what's going on? So you can actually experience a few changes. You need to rehydrate with water, because you generally find that when you first start, you may go to the toilet a little bit more. So fuel your body with quality choices to support your body as it rebalances itself with the support of EMULIN. Now, the science and technology behind it, EMULIN has had over 15 years of research. It wasn't just something that was just made at a whim. It does have clinical studies and patents attached to it as well, which take an awful lot. And one of those PubMed extracts for EMULIN is on the study of the effect of EMULIN on blood glucose in type 2 diabetics. The clinical studies was done on 40 patients of type 2 diabetes, half on metformin, half on no control. Then in the placebo, half of them had the placebo, and the other half had the EMULIN. So this is what we call a double-blinded study. that they have no idea what they're actually taking, whether they're taking the active or whether they're taking the placebo product. So it gives you a really true indication on what the clinical study is. If we look at what our competitors are, I said to you that there is 7 key elements on where there's traffic cops. So there's 7 pathways that make EMULIN unique, the magic 7. So if we look across the top again, so it helps with starch to sugar conversion, glucose absorption, the tissue uptake of the glucose, fat formation, glucose homeostasis, insulin release, and insulin sensitivity. So it's ticking off those whole 7 as opposed to some of its competitors out there on the market. And it's natural, it's food. So allow your body to find balance and unwind the feelings of dis-ease, as I said, not disease, dis-ease, with the time that it needs. It takes time to assist your body to unravel at a cellular level so you can begin to feel the support needed. So I want you to think about how long have you been navigating and trying to manage your body's symptoms you're struggling with right now. So when you come across somebody that you're talking to, ask them that question. How long have they been navigating and trying to manage what they're dealing with? Has it been 1 year, 5 years, 10 years? So it's going to take time to unravel. So have the patience, as EMULIN will provide you with that missing link to support your body to unravel. So if we look at wound recovery, I know this lady, she should have had a skin graft because of what it was. And to date, there is no scarring on her face at all. And it was a grease burn on the face that potentially should have had a skin graft, but she's saturated with EMULIN, and this was a result, and now you cannot see any marks at all on her face, which is quite remarkable considering. And obviously everybody's results are varied too. This is another lady, and surprisingly enough, it was a sister. So I was thinking, what are you girls doing? And it's a burn victim, and it's quite a severe burn victim. But after 1 week, this is how fast it was. But it was a saturated dose, 12 to 14 a day to help that body to send the troops in to start that healing process for the body to heal itself. This is psoriasis. So again, it's another quite a severe case that you can see that in a short span in time, it's been able to give it the support that it needs for the body to be able to heal itself. I did speak about the banned substance control label that we have. This is a really big deal because having any product that is recognized by an Olympic governing organization that they recognize is actually phenomenal. It really is, but it's not just for the sporting world. And I don't mean professional sporting people. I'm talking about your kids that are playing sport, that are playing soccer, that are playing baseball, that are swimmers, that all of a sudden find them in college sport or they're in the Institute of Sport because they will get drug tested. So it's anybody that's involved with sport. But more importantly, as we move forward and we evolve, it's the workplace as well, because there's more and more workplaces are being drug tested as well. You can go into their site and you can see for yourself that Valentis has gone through the process. It is for EMULIN M only. I will say that EMULIN C was tested and it did pass, but it just didn't, they didn't pay for the label for the banned substance control seal. So we can only advertise that it is EMULIN M only because that's what you're going to see on the website when you go there. What did I say? It was a big deal because it's over 496 illicit substances. And what that means is that this product is sent to this governing body and they inject over 496 illicit substances. They must be able to withdraw them all. That then proves to them that it's not a masking agent. So then therefore it cannot mask illicit substances, that when they go to have a drug test, that they know that they're going to be safe with it. But of course, I've got a huge interest in professional sport and the workplace as well. People need to do their own research as well. And to be compliant, you need to look at, ask people to go to that webpage. Please do your due diligence and let them do their own research so that you know safely that you've done your job correctly. Now, the other two products of Dr. Ahrens is 24/7 AM and PM. And it's quite a remarkable product, I feel. And I love this product because it layers on top of EMULIN. And there's a big reason for it. You know, one works through the day and the other works of a night time. And it does some pretty special things. So when we start looking at the AM formula, helps you burn carbs, blocks carbohydrates, promotes the well-being, mental alertness, supports you in appetite control. And it actually does. I mean, there have been reports in regards to wrinkle and cellulite control as well, where you may see some differences there also. But it does depend on what you eat and what you fuel your body with too. You've got to be realistic about what your choices are. Then, of course, going into the nighttime formula, which is the blue one, the PM, it's still working while you're sleeping. This is the beauty of this product. Whilst you sleep, it's still working. So it's still looking to aim to burn carbs, block the carbohydrates, promote that well-being, but it has a melatonin in it. So it's helping you with sleep to promote better sleep. It does work on the fat tissue throughout the body whilst you're sleeping. And again, the wrinkle and cellulite control. It has 2 active ingredients in it, the same as EMULIN. This is why it is such a phenomenal product to add on top of EMULIN, because it layers on top of. One of those is the chlorogenic acid, the green coffee bean. So when we start looking at all of these areas here and what it potentially is looking to support the body as it helps itself to heal, this is what this extract is doing for you. It also has the myricidin in there as well, the great promise. What it doesn't have in there is the quercetin as to what's in EMULIN. So this is where you start looking at having 24/7 AM, PM. You can take it on its own if you want to, but if you're taking it in conjunction with EMULIN, it becomes what I like to refer to as the perfect marriage, because it layers together to provide you with phenomenal support and phenomenal results. I want to tell you why I'm so passionate about where I'm at with this, this product. This is my personal thoughts. This is my personal experience, because life prior to EMULIN for me was in hospital. I was on many medications at the doctor's twice weekly, sometimes more, from when I was born right through to 6 years ago. I had actually lost all hope. So being in hospital like this for me was a regular occurrence for me. And my symptoms now, thankfully, have been supported with both of these products. And a list of all of these conditions down the side here, from chronic bladder surgery, and I still have it every 3 months, but I was operated on at 2 hours old, and I had the first 2 years in hospital with a series of surgeries. So it went into chronic bowel conditions, fibromyalgia, sensory peripheral neuropathy, chronic pain, depression, anxiety, insomnia. I was on 14 scripted medications, and I had over 28 major surgeries, and to date I've had over 350 day surgeries as well. So it's been quite a lengthy journey for myself, to be honest, to get to this stage now where I can comfortably say my body is helping itself to be healed, healing itself with the support of EMULIN and with 24/7 as well. So one of my favorite mottos is to put it out there, to invest time in your health before your health invests all of your time. And I do want to thank each and every one of you for listening to that call today, because hopefully it has provided you with some information as to why both of these products potentially can make a huge difference in anybody's daily intake, but to allow it to give it that time to be able to assist you. So I want to try and keep this clean. I'm happy to answer some questions afterwards, but on behalf of Dr. Ahrens, I want to thank you for showing up and always supporting him. For those people on the other side of the pond, as I refer to, happy Thanksgiving. And I hope that you have a wonderful day, and you have had a wonderful day with your family and your friends. And we look forward to seeing you next week. So thank you so much.